Hello everyone, welcome to the M3 Academy. Am I audible? Please give me response in the chat box. Yes, we are starting the live YouTube class on the Friday figures. All the variable things in the obs and gynae, which are increases, which are decreases in the one shot in this class. So please tell me in the chat box. The audio visual is all good. Please give me a quick response so we can start the session. Yes, is the screen visible to you? So in MRC group, yesterday we have covered so many chapters of the gynae, obstetrics, the changes in pregnancy. So today's session is the live interactive session in which we have to answer the things which we have learned in the recent classes. Yes. So shall we start? Shall we start now? Yes. Are you ready for the answer? Shall we start the session? First, see this picture and tell me in the comment what is this picture showing. What is this picture showing and what you remember by these pictures? Those attended our yesterday session, sir, please give class on hypersensitivity. Yes, sir, we will make the session on the hypersensitivity mnemonics. So this is the candy, this is the candy, this is the candy, this is the candy, and we know pregnant lady like candy, pregnant lady like candy. So what is the meaning of this sentence? Pregnant lady like candy, pregnant lady eat more candy, eat more candy. Yes, very good answer, Dr. Mallika here. So pregnant lady like the candies means the candidiasis. So most common vaginitis in pregnancy, which is the most common cause of the vaginitis in the pregnancy, is candidiasis. So pH of the vagina in pregnancy, what is the pH of the vagina in pregnancy is 3.5. And what is the normal pH of the vagina is a 4.5. You can say in the pregnancy the pH of the vagina is decreases, so pathological organism not grow, but candida can survive in this decreased pH. So you can remember pregnant lady like candy means the candidiasis is the most common cause of vaginitis in pregnancy. Candida can survive in the lower pH. Yes, and you can say all the good things happening in the pregnancy, all good things are increases. So in the vagina you may found the lactobacilli produces lactic acid by the glycogen, vaginal epithelium glycogen. By this acid vaginal pH decreases from 4.5 to 3.5. So it is a good thing. So just remember, pregnant lady like more candy, pregnant lady like more candy. So candidiasis is the most common cause of vaginitis in the pregnancy. Now next things, what you remember by this picture, tell me in the chat box which point you can remember by this butterfly. This butterfly in the pregnancy, butterfly increases in the pregnancy. What is this meaning by the butterfly? Where you see butterfly rush, where you see butterfly rush, just tell me in the chat box. Butterfly rush is seen in, yes, answer in the chat box. Yes, SLE, very good answer, Dr. Mallika. This is seen in the SLE. As you say, as I say in this picture, butterfly increases in pregnancy. So SLE increases in the pregnancy. So SLE flare up in the pregnancy because in pregnancy there is a T helper cell increases, T helpers 2 activity increases. How we remember, in the pregnancy, toward the pregnant woman the immunity increases, so many people come to help the pregnant woman. So T helper 2 means the 2 people come for the help to the pregnant woman for the immunity. So T helper 2 increases, or you can say immunity means the humoral immunity increases, and T helper 2 mediated disease like SLE also increases, mean the flare up, means the flare up. Yes. Now next diagram, see this diagram and tell me what we relate by this picture. Those attended our yesterday's session, what you relate by this picture, what you see in this picture, this is, what is this? Yes, what is this? This is ice cream. This is ice cream, and you can say pregnant lady eat more ice cream, eat more ice cream. So ice cream, icy means the inspiratory capacity. Yes, so pregnant lady eating more ice cream means inspiratory capacity increases. And what we studies in the respiratory changes yesterday. Yes, Dr. Sofa, very good answer. So ice cream increases. And also we see TV, pregnant lady watch more TV, so TV means tidal volume is increases. Pregnant lady watch more TV, so TV for the tidal volume increases. And more ice cream, so inspiratory capacity is increases. Yes. And pregnant lady stay less on the floor. Most of time pregnant ladies sit on the chair and stay less on the floor means the FRC, so FRC decreases. And the other parameter like the respiratory rate is the same. Respiratory rate, breathing maximum breathing capacity is the same. Yes. Shall we proceed to next? Yes, see this picture, what is happening in here? Somebody helping to the pregnant woman. Sir, can you repeat SLE 2? Yes, SLE. As you see butterfly in the pregnancy, butterfly increases. Butterfly indicate butterfly rush, which is SLE. So SLE flare up in the pregnancy. Yes. So next one, see this picture and tell me what is happening here. So what is happening here? Somebody show humanity toward the pregnant woman and trying to help. So in the towards the pregnant woman, humanity is increases, or 2 people come for the help. So you can say humoral immunity. Humoral immunity is increases. T helper 2 is increases. 2 T helper 2 is increases, and other is cellular base immunity is decreases. Now the next one is, see this picture. What this picture indicate and what we remember by this picture? Nutella. So pregnant lady eat more Nutella. Pregnant lady eat Nutella. Pregnant lady eat more Nutella. Nutella means neutrophil. So neutrophil increases in the pregnancy, or you can say in the pregnancy, pregnant lady eat more tea. As you see here from the tea picture, see this, pregnant lady drink more tea. You can say pregnant lady drink more tea. So what is the meaning of tea here? Pregnant lady eat more tea. So T for T4, you can say T lymphocyte. T lymphocyte increases. You can say watch more TV, so T4 tidal volume also increases. And T4 TLC means the total lungs capacity. No, T for the total, not the total lung capacity. Here the T for has a T for the TLC, total leukocyte count. Yes, total leukocyte count is a increases. So T से क्या क्या याद किया? T lymphocyte, tidal volume and total leukocyte count are increases. So just remember, pregnant lady eat more tea. Now next thing is the see here, after Nutella, so neutrophil is increases. And so we can say T lymphocyte means pregnant lady drink more tea, so T lymphocyte increases. More Nutella, so neutrophil is increases. Yes. Tell me in the chat box what is happening to the B lymphocyte. What happening to the B lymphocyte? B lymphocyte के साथ क्या होता है? Yes, tell me in chat box. B lymphocyte का नंबर जो है वो सेम रहता है. B lymphocyte सेम, not change. Be same. So we are saying to pregnant woman, be same. Do not change. Be same. So B lymphocyte is same. Now see this picture. What this picture is showing to you, fiber. So we suggest pregnant woman to eat more fiber diet, because you know constipation is very common in the pregnancy, so hemorrhoid problem can be occur. So we advise eat more fibers, eat more fibers. So what is the mnemonic from the fibers? Fibrinogen, fibrinogen. So fibrinogen increases in the pregnancy. As you know, pregnancy is a hypercoagulable state. Pregnancy is a hypercoagulable state. Yes, constipation due to progesterone. Pregnancy is a hypercoagulable state. So all the clotting factor increases except, all the clotting factor increases except, tell me in the chat box what is the bad clotting factor, what is the bad number, what is the odd number. So bad or odd thing decreases in pregnancy, because all good things are happening in the pregnancy. सारी अच्छी चीजें pregnancy में होगी, but खराब चीजें नहीं होगी. So bad number is, what is the bad number? 11 and 13. So this factor are decreases, and all other factors, clotting factor, protein C, protein S, fibrinogen, all this, yes, all this increases. So pregnancy is a hypercoagulable state, pregnancy is a diabetogenic state, and pregnancy is a hyper BMR state. Yes, pregnant lady like candy, butterflies, ice cream, Nutella, drink more tea. Very good, Dr. Win Blastin. Now next one is, see this paratha. What this paratha indicate? Pregnant lady eat more paratha. Paratha, aloo paratha. So what is the meaning of this aloo paratha here? Aloo paratha, pregnant lady eat more aloo paratha means ALP. Yes, tell me in the chat box what is the aloo paratha ALP. So ALP enzyme, this is a liver enzyme, increases in pregnancy. ALP. Yes, see this picture, the laughing, the laughing improve, laughing improve in pregnancy, improve in pregnancy. As you see, these pregnant women are very happy, and is laughing skill is improve. What is the meaning of this laughing? Laughing means, just tell me in chat box. Laughing means hasna. Hasna means Hashimoto thyroiditis, Hashimoto thyroiditis. And this miss means the multiple sclerosis, multiple sclerosis. So multiple sclerosis, RA, MS, and a Hashimoto thyroiditis, these all condition improves in pregnancy, improves in pregnancy. Why this condition improve? Because we know T helper 2 increases, so T helper 1 activity decreases, and T helper 1 mediated diseases, rheumatoid arthritis, multiple sclerosis, and Hashimoto thyroiditis are also decreases. This activity decreases, this disease severity decreases. So we can say this disease improves in pregnancy, improves in pregnancy. Is it clear? Yes. So see this next picture. This is the hot soup. What you can understood by this hot soup? Pregnant lady eat more hot soup. Pregnant lady eat more hot soup. So क्या बन रहा है यहाँ पे hot soup से? Comment section में बताएंगे. Hot soup. So pregnancy is a hot state, and pregnant lady looking too much hot in the pregnancy. So what is this meaning of the hot air? BMR increases by 20%. Yes, and a hot means the inflam. Hot means the inflam. So all inflammatory mediators are increases. So inflammatory things like ESR, like CRP, like fibrinogens, all increases. So ESR increases, fibrinogen increases. Yes. And what are the anti-inflammatory interleukin? What are the anti-inflammatory interleukin? Tell me in the chat box. Anti-inflammatory interleukin, 4 plus 10 equal to 14, but not 14 here, 13. So 4 plus 10 equal to 14. So 4 and 10 and 13 are anti-inflammatory interleukin are increasing in pregnancy, because we need anti-inflammation for the inflammation. Yes, everybody clear about this? Pregnancy is a hot state. Now next one is the this is the candy, and this is also candy. So see there, pregnant lady they use less plates for the food, and pregnant lady eating by the spoon, eating by the hand. So using more less plates. So what is the meaning of less plates here? Less plates here. Tell me in the chat box. Less plates. Yes. So less platelet count. Less platelet count. So platelet count become less but not less than the normal. Platelet count कम होता है but normal से कम नहीं होता है, तो इसको अपन बोलते हैं gestational benign gestational thrombocytopenia. benign gestational thrombocytopenia. तो लेवल कम होगा बट नॉर्मल से कम यहाँ पे लेवल नहीं होगा. Yes, so you can remember so many so many changes in the pregnancy in the one shoot. And you can see pregnant lady watch more TV. Pregnant lady watch more TV in high volume. In high volume, it plays song in high volume because pregnant lady keep laughing, so keep happy, so it plays song on the high volume. And the dancing, high volume means the volume increases. So which volume is increases here? Which volume is increases? All type of volume: plasma volume, blood volume, or blood volume, plasma volume, or water content is increases. So around 6 liter water increases. So by this hemodilution can happen, hemodilution. And if the volume increases, so what is the formula of the concentration? Mass upon the volume. So if volume increases, then concentration is decreases. So we can say hb mass is increases, but when we say hb concentration is decreases, because concentration inversely proportional to the volume, so hb concentration decreases. Yes, everybody clear about this? And see this female, this is the goal motol female, this is the goal mole female. Goal mole means the healthy, healthy means the thick, healthy or fatty female. You can say this is a healthy female. So goal moles G4, which protein, which plasma protein increases in pregnancy? Tell me in the chat box which plasma protein increases in the pregnancy. G4 globulin. Globulin increases. So all the globulin like sex hormone binding globulin is increases. And in contrast to globulin, जो दूसरी चीजें होगी एल्बुमिन. एल्बुमिन क्या हो जाएगी? एल्बुमिन यहाँ पे हो जाएगा कम. एल्बुमिन यहाँ पे हो जाएगा कम. So now for the summary, see there the 13 number. Tell me the 13 interleukin 13 and the factor 13. So what happening to the interleukin 13 and the factor 13? Sir, can you please repeat all the food item again? Make it. Yes, I will repeat. Yes. तो 13 यहाँ पे बताओ. 13 से interleukin 13 is a anti-inflammatory interleukin, so it is a good, so it is increases. Factor 13, so factor 13 is a bad factor, so it is a decreases. Yes, yes. So this class will be recorded, you will watch it later. Yes, so no need to repetition. So you understood 13, interleukin 13 and factor 13? Yes. So we summarize all the things like aloo paratha, candy, and a TV, and a Nutella, and ice cream, and fruits, fibers, plates, butterflies, and all. किसी को कोई याद आ रहा हो तो कोई चीज़ बता सकते हैं, वो अपन इस सेशन में यहाँ पे ऐड कर लेंगे. Do you remember any things which I have discussed yesterday? Then we can include in this session. So in this way we can learn about the whole changes in the pregnancy. Just see candy, more candidiasis, butterfly, more SLE, more inspiratory capacity. You can set more help, humoral immunity, T helper 2, more neutrophil, more fibrinogen. You can say more LP. You can say more improve Hashimoto thyroiditis. You can say hot state, so BMR is increases, ESR, CRP is increases. And T for the, yes, garam pregnancy is the garam state. So here is a BMR increases, blood flow increases. If blood flow to kidney increases, if the blood flow, pregnancy garam state, why garam, because blood flow increases. If blood flow increases to kidney, GFR increases. If GFR increases, then blood urea, serum creatinine decreases. So we can remember this point about the kidney, and kidney size increases by 1 centimeter. And you see there are so many water in the pregnancy. So many water in the pregnancy. Water means the pani. So pani in the kidney means hydroureter, means the hydroureter. Yes, subcostal angle. See the picture of the girl here. State. See this picture. So subcostal angle in the non-pregnant woman is 68. In the pregnant woman it become 103. So how you can remember this? In the pregnancy the family become the 3-person family, means the father and mother and a child. So 3-person family. So earlier pregnant woman is single. Now after pregnancy it become the 3-member family. So 1 2 3 supper mean the 103 angles, subcostal angles. So subcostal angle in non-pregnant woman is 68. In the pregnant woman is a 103. It's clear to you? Yes. So diaphragm up by in the pregnancy, diaphragm up by dia means 2, so just add 2, so 4 centimeter, diaphragm up by 4 centimeter. So less space for the lungs, so tidal volume, reserve volume is decreases, so reserve volume is decreases. Yes. So diaphragm. And what for the transverse diameter? What for the transverse diameter? So transverse diameter you can say T for the 2 centimeter. So transverse diameter increases by the 2 centimeter. And what is for circumference? Tell me in the chat box. Circumference, what will happening into circumference of the circumference. So circumference C, इसी से अपन क्या बना सकते हैं 6. So circumference increases by 6 centimeter. So diaphragm up by, dia means 2 plus 2, so 4 centimeter. Transverse diameter T for the 2, and the circumference C से क्या बना सकते हैं 6, so 6 centimeter. And subcostal angle we have studied. Yes. Anybody anything more you want to discuss? Please tell me in the chat box. Anything more you want to discuss? You want to revise any changes? Yes. FRC decreases. Yes, pregnant lady are not sitting on the floor. See here, pregnant lady sitting on the chair. So is using less floor, or less time spending in the first. So FRC decreases. Yes, very good answer here. FRC decreases. Anything more you want to revise? The blood volume increases. We already revised the blood volume. And wait for the, yes, blood volume. Now this pregnancy is a red and hot state. As you see this girl, no, see this girl, see this girl. So pregnancy is a red and hot state, means the pregnancy is a garam red and hot state. Red means the blood volume increases, blood flow increases. In this way you can remember their blood. Red means erythro, so erythropoietin increases. If erythropoietin increases, then more blood forms, so more reticulocyte. You can say more number of the RBC, so number of the RBC increase, number of the reticulocyte increase, and maternal erythropoietin is increase. Is this clear to you? How we remember this? Yes. And pregnant woman become goal-matol. Goal means obese. Obese means globulin. So globulin is increases. And what is happening to the albumin globulin ratio? Globulin ratio in normal in the pregnancy. Tell me in the chat box. Albumin globulin ratio. Normal is the 1.7 is to 1, but in the pregnancy is a 1.1. How you can remember? As you know, albumin globulin, pregnant woman become goal means obese, so globulin increases and albumin decreases, so ratio become equal. So in pregnancy 1:1 ratio, you can say in pregnancy 1:1 ratio, one fetus one mother equal 1:1 ratio. Yes, very good answer here. Now the WBC we say the blood we already discussed. Now next thing is the Which parameter is unchanged during pregnancy? So which blood parameter are unchanged? Just tell me in chat box which blood parameter are unchanged. You can revise all the things. Please use active recall. You will remember forever if you answer in the comment. Yes, don't worry, don't hesitate if you answer incorrect. I will correct you. So blood, which parameter unchanged? Unchanged, B same, B same. So B lymphocyte is same, B lymphocyte is same. CD4 to CD8 ratio is same. Yes, B same. So B means BTCT is same, and the anti-thrombin time is same. तो क्या याद करेंगे? B same in the pregnancy. बी लिम्फोसाइट सेम रहेगी, बी से बीटीसीटी सेम रहेगा, और इनका रेशो सेम रहेगा, और एंटी थ्रोम्बिन सेफ रहेगा. नाउ व्हाट इज हैपनिंग इन द आयरन? फॉर आयरन के लिए क्या है? ऑल द आयरन पैरामीटर आर डिक्रीजेस. So what happening about the iron parameters? All iron parameter are decreases, but except tell me in the chat box, all iron parameter are decreases during pregnancy, like total iron, serum ferritin. But टी, एज यू नो, टी का मीनिंग क्या था? टी, प्रेग्नेंट लेडी ईट मोर टी, वॉच मोर टीवी. सो टी का मीनिंग क्या है यहाँ पे? टी आई बी सी. यस, टी आई बी सी इंक्रीजेस, क्योंकि टी आई बी सी का फुल फॉर्म क्या है? टी फॉर दी टॉप, आई फॉर दी iron deficiency anemia. As I say, all the iron parameter decreases in the pregnancy. Iron parameter decreases means the TIBC become top. T for top in iron means TIBC क्या होता है? टॉप इन आयरन, बॉटम इन द क्रोनिक एनीमिया. सो TIBC वैल्यू मोर इन द iron deficiency. So TIBC increases. And another T, tell me in the chat box, another T, which is another T here? Transferrin level. Yes, T for TIBC and T for the transferrin level. Yes, very good answer here. And what is the iron preparation in Mala N and Mala D? Mala N and Mala D, which iron preparation? Yes, tell me in the chat box which are iron preparation used for the Mala N and Mala D. Ferrous, yes, ferrous fumarate. And for the IFA tablet, ferrous sulfate. Yes, very good answer here. And what is the mnemonic of relax and reflex? Anybody remember the mnemonic? Relax and reflex. रिलैक्स एंड रिफ्लेक्स. सो व्हाट इज द निमोनिक? रिलैक्स एंड रिफ्लेक्स. क्या पढ़ा था अपन ने? कि प्रेगनेंसी में प्रोजेस्टेरोन बढ़ता है, प्रोजेस्टेरोन इंक्रीजेस. दिस प्रोजेस्टेरोन रिलैक्स द लोअर esophageal sphincter. It causes the reflex means the heartburn, or you can say GERD. So in this way you can understood relax and the reflex by the progesterone. And another one is the constipation and the hemorrhoid. So we are saying woman to eat more fiber. Yes, very good answer here. So in this way we have revised the things. So which respiratory parameter normal in pregnancy? Which respiratory parameters normal in pregnancy? Tell me in the chat box. Just revise, use your active recall. Those attended our yesterday's session. Yes, which parameter normal in the pregnancy? Remains same, remains normal. Yes, कौन से पैरामीटर सेम रहते हैं प्रेगनेंसी में? remain regular, remains same. Yes, this is the trick. So respiratory rate is same. You can say inspiratory reserve volume is same. Just double this R and just add V2C. तो यहाँ पे कैसे याद करेंगे अपन? यहाँ पे केवल इतना से याद रखना है, IRV सेम रहता है, R को डबल कर देंगे और V के पीछे C लगा देंगे. V के पीछे क्या लगा देंगे? C. तो देखो यहाँ पे काफ़ी आसानी से याद कर पाए अपन. IRV R को डबल किया, रेस्पिरेटरी रेट V के पीछे C लिखा, एंड वाइटल कैपेसिटी. वन मोर थिंग, मैक्सिमम ब्रीदिंग कैपेसिटी इज सेम. Yes. So is it clear to you? All the changes in the pregnancy? If you have any doubt, you can ask me in the chat box. Yes. कोई डाउट हो तो चैट बॉक्स में बता सकते हैं. अपन ने यहाँ पे हेमेटोलॉजिकल चेंजेस, रीनल चेंजेस एंड ये चेंजेस यहाँ पे पढ़े. वेजाइनल चेंजेस भी देखे. इसके अलावा ब्रेस्ट में क्या चेंजेस होता है? व्हाट चेंजेस सीन इन द ब्रेस्ट? दिस ट्यूबरकल, Montgomery tubercle. And when you see the Braxton Hicks contraction at which trimester? Braxton's Hicks contraction at which trimester? Braxton Hicks contraction. Hint is a B. B is a second letter. B is a second letter. So seen in second trimester. So please keep adding all the point in your OBG mnemonics, OBG numbers diary, which we shared. Yes, very good, doctors. Sofura here, second trimester. And where serum FLT, serum FLT is increases. Just tell me in the chat box where serum FLT is increases. Serum FLT. Serum FLT in the pregnancy induce hypertension. Now, next one is the, so in this way we covered the, now some point about the weight. So see this uterus weight. So what is the weight of the uterus? Weight of the uterus in non-pregnant and a pregnant woman. Tell me in the chat box what is the weight of the uterus in the non-pregnant and a pregnant. Non-pregnant, it is the 80 gram, and a pregnant is the 1000 gram. Yes, 1000 gram. And hypertrophy means the size बढ़ना, hypertrophy more than the hyperplasia. And the shape of the, what is the shape of the uterus in normal and a pregnancy? Shape of the uterus, yes, tell me in the chat box. Yes, 5 to 6 kg is the net weight gain, and weight gain in pregnancy is the 10 to 12 kg. So what is the shape of the uterus in normal woman is a pear shape, and in a pregnancy, tell me in the chat box. Yes, in pregnancy the shape of the uterus is globular. As you know, pregnant woman become goalmatol, so you can say globular, you can say spherical, you can say ovoid, you can say abdominal. So all these type of the shapes, or what you have remember by this globular shape. अनदर थिंग्स, ग्लोबुलर से और क्या याद किया था अपन ने? फटाफट से जवाब दो, फटाफट से कमेंट सेक्शन में बताएंगे। ग्लोबुलर से और क्या याद किया था? जी से विच प्लाज्मा प्रोटीन, ग्लोबुलिन, ग्लोबुलिन यहाँ पे बढ़ जाती है, ग्लोबुलिन। यस, वेरी गुड आंसर। एंड टाइप इन द चैट बॉक्स थायरोक्सिन डिमांड increases by which percent? Thyroxine demand increases by, because fetus is dependent on the mother for thyroxine. Fetus is dependent on mother for thyroxine. So thyroxine demand is increases, so those should be increases by. Yes, tell me in the chat box. Those attended our yesterday's session on the MRC group on the Telegram, please answer. So fetus is dependent on the mother for thyroxine. So thyroxine dose of the thyroxine should be increases by 30 to 50%. 30 to 50% in pregnancy. Yes. So fetus is dependent on mother for thyroxine, also for the calcium, also for the vitamin D. So we are giving calcium, vitamin D, and also for the glucose, and insulin resistance in the pregnancy. So tell me which hormone responsible for the insulin resistance in the pregnancy? Which hormone which have lactate in the name? HPL, ह्यूमन प्लेसेंटल लैक्टोजन। तो इसमें क्या लैक्टोज नाम होता है? लैक्टोज क्या एक तरह की शुगर क्या करेगी? डायबिटीज। सो इफ मदर इज हाइपरथायरॉइड एंड टेकिंग थायरोक्सिन, कैन, if mother is hypothyroid taking thyroxine, can we get a swing if mother is hypothyroid and taking thyroid supplement, then thyroid level become normal, so no sign of congenital hypothyroidism. Yes, so if you fulfill the demand of the thyroxine in the pregnancy, so no issue will be created. So what is the which hormone causative agent for the insulin resistance is the HPL, human placental lactogen, L4D lactogen. Lactose is a sugar, so it is a diabetogenic hormone. And when we see insulin resistance in the pregnancy, tell me in the chat box when we see insulin resistance. The 24 to 28 week maximum, 24 to 28 week. How you remember? Just 2 and 2 fix, just 4 ka double 8, so 24 to 28 week. Yes. So pregnancy is a diabetogenic state. So we can say in the one sentence, pregnancy is a diabetogenic state. Pregnancy is a hypercoagulable state. Yes. Pregnancy is a immunocompromised state. Pregnancy is a diabetogenic state, hypercoagulable state, and an immunocompromised state. And pregnancy is a hot state. Hot means BMR increases, ESR, CRP, blood flow, blood volume, all those things. Yes. Shall we proceed to next? Do you understood the mnemonics in this? Yes. So please revise this photo by yourself. Keep a note this photo and share on the our Telegram group. So I am using this disappearing pen. Just this pen will disappear. So you will annotate. You should annotate this page yourself. Already shared this page on our टेलीग्राम ग्रुप. पहले ये पेज टेलीग्राम ग्रुप पर पोस्ट कर दिया है, तो आप वहाँ से इस पेज को डाउनलोड करेंगे और इस पेज के ऊपर खुद लिखेंगे कि कैंडी क्या बता रही है, बटरफ्लाई क्या बता रहा है, टीवी क्या बता रहा है. और जैसे आप इनको लिखेंगे तो आपको सारे के सारे चेंजेस याद हो जाएंगे, क्योंकि एग्ज़ाम में ये चेंजेस ही गड़बड़ किए जाते हैं. एग्जामिनर इन चीज़ों को कम ज़्यादा कर देता है. पेपर कैसा है, एमसीक्यू एग्जाम में क्या होते हैं, ऑप्शंस होते हैं, और एग्जामिनर ऑप्शन कैसे बनाते हैं, चीज़ों को जो वेरिएबल चीज़ें होती है उनको कम ज़्यादा कर देते हैं. मोस्ट ऑफ द नंबर्स एंड द वेरिएबल. तो जो भी दो ऑप्शन देखें, यदि किसी ऑप्शन में लिखा है इंक्रीज, किसी ऑप्शन में लिखा है डिक्रीज, पीछे की चीज़ सेम है, तो आंसर उसी में से जाने के चांसेस रहते हैं. तो कैसे इसको रिलेट कर सकते हैं अपन? तो यहाँ से ये एक तरह से चीट कोड आपके सामने निकल के आ सकता है. वैसे आप आसानी से इनको देख सकते हैं. So we will taking the endocrine changes in the pregnancy in the next session. So we'll cover the hypothyroidism and diabetes and other topic, the cardiovascular changes and the endocrine changes in the our next session on the MRC group. So you can join our Telegram group. We will take live classes on the Telegram also. Yes. Shall we finish this session? Do you have any doubt? We are finishing this session now. Just remember and make the flashcard and post to our Telegram group. Yes. So thanks for the participation. Keep learning. Happy learning.